relationship between essence, qi, blood, and body fluid. So around here, qi, body fluid, the blood, essence, relationship between all those things, like this one and this one and this one. Qi, body fluid, qi, essence, blood, body fluid, all those things is most important thing is this part. Qi and blood relationship. Qi is a commander of blood, and blood is mother of qi. It's a really close relationship. If there's no qi, cannot function blood. If there's no blood, cannot function the qi too. So this is most important part. But think about that, okay? Today's hold on a moment. Then at the book we you read about the qi is the commander of blood, right? Means that blood cannot be separated from qi, and it's a formation and circulation. So really, really important concept at the board exam, and also practically you can use this concept at the clinic. This is really important. Deficiency of qi may lead to deficiency of blood, right? For this reason, when treating disorder resulting from blood deficiency and qi tonic together, so are sometimes added to the prescription. So that's why we use two kinds of tonic herbs. So if there is qi deficiency, if there's blood deficiency, we use qi tonic and also blood tonic together. So we're gonna review about this kind of case later. For example, some formula and also herbs we're gonna study about. Then you're gonna use this kind of formula, and also at the clinic you're gonna see you're gonna meet a lot of the patients like these patients. Okay. So deficiency of qi may impair of the function of controlling qi. This one is you have to concentrate on this part. Controlling blood. Deficiency of qi may controlling blood. Qi may be impaired the function of controlling blood, leading, look at this, hemorrhage, kind of bleeding. Internal bleeding everywhere in our body, like brain and intestine, stomach, anywhere, any organ, there's a possibility at bleeding. So that's why qi and blood is a really important concept. That's why blood is mother of qi. Okay. So, for example, Guipita. Did you hear about the Guipita? No? Okay. Guipitang, you didn't study about the Guipitang, but I'm going to mention some of the formula and also the herbs for more easy to the remember and familiar for the future in the clinic or the board exam. This is a well-known decoction. So this one is qi, spleen qi deficiency with heart blood and in deficiency. So for this formula, I use this formula frequently in my clinic because this really related to this formula. You're gonna see a lot of patient at the clinic related this formula. Fatigue, for memory, palpitation, insomnia, anxiety. Especially there's a lot of depression patient. If you go to the hospital because of the anxiety and depression patient, then they give antidepressant medication, right? If you give this kind of antidepressant medication, cannot fix this kind of problem, and also this make a more deeper problem and chronic problem. So cannot solve these problems. But if you use this formula for antidepressant, even insomnia too, even palpitation too, all related to blood deficiency, poor memory too, blood deficiency, fatigue too, qi deficiency, but bottom line there's blood deficiency too, and also what else? Poor sleep, cannot sleep deeply. All kind of this. There's so many people suffer with this kind of problem, right? Poor appetite. What else? Low-grade fever. This is insufficiency. And night sweating. And also, if you look at this, blood in the stool. Finally, this is a kind of internal bleeding. And also, if it's severe case, then you can think about that another organ too. So that's why you can use this herb, this formula. So Guipitang is later you're gonna study about this formula. Don't worry about it right now. But for if you listen more about the Guipitang, then later if you start study at the class, then you can think about this formula is more familiar, right? So Sijunjita and modified Sijunjita. Sijunjita is qi tonic herb formula. C means 4. By 2 and what else by Ransan, Fuling, and Gancha. This is Sujinjita. So with this one, you're gonna see the Look at this, Longyanlo, Suanjiaoren, Yuanji, and Muxiang. It's spleen qi deficiency with heart blood deficiency. I don't want to go deeper about this formula, but this is for your reference, okay? Later, you have to study about this formula detail. This definitely, California board exam, they're going to ask about this formula. This is a really important formula, okay? So if there is a bleeding, then one of these formula, you can use this formula for internal bleeding too. And depends on the patient's condition, you can modify with another kind of the herbs you can put. Look at this, Suanjiaoren and Longyanlo and Yuanji and Puxiang. This calm the spirit, nourish the heart. With this part, antidepressant patient, you can modify with these herbs. This is really good for the spirit. So if you add this one, Suanjiaoren, Longyanlo, Yuanji, then they are going to sleep more and well and calming the mind, right? And stable. This is really important. I use these herbs a lot for this, especially Fusen too. So for my brother in Korea right now, he is suffering with all this kind of problems. So he cannot sleep. So I modified with these herbs. So right now, he is really happy now because he can sleep well. Yeah. So this is Guipitang, the ingredients. This is qi. Later you can study more. Okay, I'm gonna pass this one. So spleen function. Spleen function is governs transformation and transportation. Spleen function. And you have to remember this is a really important spleen function. You have to remember this is really important. And control ascending the qi. Look at this. This one is important. Control the blood. If you cannot control the blood, spleen is deficiency. Cannot control the blood and bleeding, internal bleeding. And also control the muscle and forelimbs. Think about that. If spleen is deficiency, then muscle cannot control well too, and forelimbs cannot control forelimbs too. That's why spleen is really important. Open mouth and lips, saliva, raising the qi, and intellect, E. Think about this part, okay? Raising the qi. If spleen almost 90 or 95% of deficiency, then this is raising the qi, right? Raising the qi cannot do that, right? Raising the qi. Then, hemorrhoid. If this is really good, then if there's a hemorrhoid because of this spleen deficiency, if there's a hemorrhoid, then tonify spleen. We use herb. Hemorrhoid is pulling up, so it helps for treat for a hemorrhoid. That's the interesting part, right? Right? Nobody who iron is here, right? Okay. Bustos, no? Bustos Tessia? No. Garcia? Gabriela. You're Gabriela. Okay. Jerry Potsunia Eva? Oh, yeah, okay. Langton? Alexis? No. Okay. Oh, you're so quiet. Okay. And Natal? Okay. Panyapu? Panyapu? Patjan? Ramirez Anna is here, right? She's Ramirez Anna. Santos Ruiz, no? Okay. Anyway. Okay, for helping the hemorrhoid because of spleen qi deficiency, cannot raising the qi, then hemorrhoid. So if you tonify herbs a lot for spleen, then it helps raising the qi and much better for treat the hemorrhoid problem. That's an interesting concept, right? Yeah, but if you go to the Western hospital, then they try to let's do surgery. That's a really big problem, actually, right? So okay, so this kind of concept and spleen transportation, food qi, go to the lung and heart and blood, gathering qi. The spleen qi is a base, really important. So we study about all those upper, middle, lower burner. Okay. Spleen, transportation of fluids, and skin and intestine. If spleen qi cannot transform and transportation, then did you hear about this? You never heard about this concept, spleen qi deficiency? Then people keep complaining about I don't eat a lot, but my weight is getting high, right? And getting bigger and bigger. Did you see this kind of patient? They complaining. Yeah, but most of the people, they try to give the medication, right? Medication, but for us, we have to tonify spleen. Then that kind of the transformation and transportation function is much better. Then lose weight. Is it interesting, right? So I met many patients like this. Keep complaining. I don't eat. I just drink water, but my weight is gaining, getting bigger, right? That's really a stressful situation, but most of case, their spleen is a really deficiency, cannot transformation and transportation. Cannot transformation and transportation. That's why they are getting weight high. Okay. I mentioned about sending the qi related hemorrhoid. Okay, spleen cannot do that. Internal organ going prolapse. Hernia too, and hemorrhoid, hernia, intestine organs, prolapse of intestine organ too, cannot do spleen function well, sending the qi. They're gonna have this kind of hemorrhoid, hernia, intestine, prolapse of intestine, all those things. That's why spleen is really important. Just for reference, spleen controlled muscle, and volume. We mentioned about it before. Spleen control, spleen transport food essence to all muscle and the body, particularly the four limbs. We mentioned about this before. Okay, spleen is weak. This will be weariness and severe case muscle atrophy. You saw this kind of patient, right? Muscle atrophy, spleen qi related deficiency. That's why always you have to maintain spleen function with exercise and nutrition and balanced nutrition, and also if there's a severe case, internal bleeding or prolapse of intestine and hernia and all those things, then you have to go all together in the herb formula together, like Gui Pitang. Gui Pitang, and also modified depends on the patient's condition. Okay. Just for the reference, you can read this one, okay? And this is just a tasting for California board exam, okay? Like this, they ask like this. They give a case, and they ask about this one. So you have to study well, okay? Just for your reference. 27 years old man suffer with the lower pitch sound, cough with this part. What do you think, Gabriela? What do you think? This lower pitch sound. So don't mention about this one. Just lower pitch sound. Lower pitch. Lung qi deficiency, right? All the case you have to analyze like this. This is lung qi deficiency. Lower pitch sound, right? This is lung qi deficiency. Cough with yellow sticky nasal mucus. Yellow, what is it? What is it? Fever, right? Or fever or heat is yellow. Okay? Pain in the nose, headache, sweat, easily? What do you think? Qi deficiency. Because of Po cannot control. It easily come out. Insomnia, maybe related heart, right? So you analyze all of them and then you choose this kind of answer. And what else? Nightmare, weak voice. Weak voice is Qi deficiency. Bitter taste is related to what? Bitter taste related to what? Liver and gallbladder, like this. Fatigue, what? Fatigue, what? Qi deficiency or blood deficiency, right? Fatigue. Scanty urine, body fluid deficiency. Like yellow coating. Yellow coating is yellow. Yellow is like mentioned, the heat or fever, right? Right? Yellow coating. And sight of tongue, right? What is sight? You have to know that. Oh, good. Great. You know this, you have to know that all that part, the related organ, right? So liver or gallbladder, right? Spleen, stomach, heart, urine bladder, right? Yeah, lung too, like this. Okay, so analyze all those things, all those patient's condition, and then your best diagnosis. That means you have to know a lot of basic information related to lung, spleen, stomach, all those things. Okay. Okay, this is just taste. Okay. This is a kind of tongue diagnosis. Tongue. Today's class is a little off of, you have to deal with the theme, Qi, body fluid, all the things, okay? So, I'm gonna make a DVD file, okay? This one, and then you just review through the DVD file, okay? So think about the red. Okay, let's stop here.